After the age of 70, the body begins to communicate differently. It does not always send loud signals. There is often no sharp pain, no sudden collapse, no dramatic moment that forces attention. Instead, the body speaks quietly. Many older adults assume these subtle changes are just normal aging. They ignore them, adapt to them, or push through them. But doctors who work with aging patients know something important. After 70, the body often sends warning signs long before a serious health problem appears. These signs are not meant to frighten you, they are meant to protect you. The body is intelligent. It tries to alert you early while there is still time to adjust, treat, and improve quality of life. The danger comes not from the signs themselves, but from ignoring them. Let us begin by understanding why warning signs after 70 deserve special attention. As we age, the body's ability to compensate decreases. When you were younger, the body could hide problems for years. After 70, that safety margin becomes smaller. Small changes can have bigger consequences. That is why recognizing early signals matters more than ever. The first warning sign the body often sends after 70 is persistent fatigue that does not improve with rest. Feeling tired after activity is normal. Feeling exhausted most of the day, even after sleeping, is not. Doctors frequently hear older adults say, "I'm just tired because I'm old," but ongoing fatigue can signal heart strain, poor circulation, anemia, sleep disorders, or medication side effects. This kind of fatigue feels deep. It affects motivation, focus, and recovery. It is not solved by naps alone. When fatigue becomes a daily companion rather than an occasional visitor, the body is asking for attention. The second warning sign after 70 is unexplained changes in walking or balance. Slower walking, shorter steps, or frequent stumbling are often dismissed as weakness. But walking is one of the most complex actions the body performs. It requires coordination between the brain, nerves, muscles, and inner ear. Doctors have found that changes in walking speed and balance often predict future health problems. They can signal neurological changes, muscle loss, poor circulation, or even early cognitive decline. Falls are not random accidents in older adults. They are often the result of ignored warning signs. When balance feels less reliable, the body is asking for support, not silence. The third warning sign after 70 is sudden or gradual loss of appetite. Eating less occasionally is normal. Losing interest in food over weeks or months is not. Appetite is closely tied to digestion, hormones, mood, and overall health. Doctors often see appetite changes before serious illness appears. Reduced appetite can lead to malnutrition, muscle loss, and weakened immunity. It can also signal depression, digestive problems, or medication interactions. After 70, the body requires consistent nourishment to maintain strength. When appetite fades, the body is warning that something is out of balance. The fourth warning sign after 70 is increased shortness of breath during routine activities. Getting winded after climbing stairs may seem harmless, but when breathing becomes noticeably harder during activities that were once easy, it deserves attention. Breathing changes can signal heart issues, lung problems, anemia, or fluid retention. It can also reflect reduced oxygen delivery due to poor circulation. Doctors emphasize that breathing changes are especially important after 70 because the heart and lungs work harder to compensate for age-related changes. Ignoring breathlessness is risky. It is one of the body's clearest signals that something needs evaluation. The fifth warning sign after 70 is frequent dizziness or lightheadedness. Feeling dizzy when standing up, turning quickly, or walking can indicate blood pressure instability, dehydration, heart rhythm issues, or medication effects. Many older adults accept dizziness as normal aging. Doctors do not. Dizziness increases fall risk and often points to underlying problems that are treatable. The body uses dizziness as a protective signal, urging you to slow down and investigate before injury occurs. The sixth warning sign after 70 is noticeable changes in memory, focus, or mental clarity. Occasional forgetfulness happens at any age, but persistent confusion, difficulty concentrating, or trouble following conversations can be early signals of cognitive stress. Doctors stress that the brain is sensitive to sleep quality, circulation, nutrition, and emotional health. Mental fog can result from poor sleep, medication interactions, vitamin deficiencies, or reduced blood flow to the brain. After 70, the brain often signals distress quietly before more serious decline appears. Paying attention early allows for intervention that can preserve independence longer. The seventh warning sign the body sends after 70 is changes in sleep patterns that affect daily function. Waking frequently, sleeping lightly, or feeling unrested despite enough time in bed are common complaints. Poor sleep affects every system in the body. It increases inflammation, weakens immunity, strains the heart, and worsens memory. Doctors often say that sleep problems are not just symptoms, but risk factors. When sleep quality declines and daytime functioning suffers, the body is signaling that its recovery system is under strain. Now let's talk about what these warning signs mean together. One sign alone may not indicate a serious problem, but patterns matter. Doctors look for clusters: fatigue combined with breathlessness, balance issues combined with dizziness, sleep problems combined with memory changes. These combinations often tell a clearer story than any single symptom. The most important message is this: after 70, ignoring warning signs does not make them disappear. They often allow them to grow quietly. Listening doesn't mean panicking. It means observing, adjusting, and seeking guidance when needed. Simple steps can make a powerful difference. Regular medical checkups help identify issues early. Gentle physical activity supports balance and circulation. Proper nutrition maintains strength. Hydration stabilizes blood pressure. Good sleep routines protect the brain and heart. Equally important is self-respect. Many older adults minimize their symptoms because they don't want to be a burden. But caring for your health is not weakness, it's wisdom. Longevity is not only about living longer, it's about maintaining clarity, stability, and dignity in daily life. The body after 70 is not fragile, it is experienced, it has learned how to survive. It simply needs to be heard. If you notice any of these warning signs in yourself or someone you love, don't dismiss them. Observe them, talk about them, address them early. The body speaks quietly, but it always speaks with purpose. Thank you for spending this time with us. We look forward to sharing more wisdom with you in the next video.